I would like to invite you to to officially talk about our
Yeah,
speaker and the current topic today. Over to you.
okay. Good evening. Myself, Dr. Deepak. I'm a senior consultant and head of the department at plastic surgery at Believers Hospital. July 15th was celebrated as the World Plastic Surgery Day, and we had some celebrations and events and activities as part of the World Plastic Surgery Day yesterday. And over this month, it is continuing. And it's the first time that we have been invited to chair the session. So regarding plastic surgery, as everybody might be, most of us might be unaware of the spectrum or the varied areas a plastic surgery deals with. And there are many misconceptions regarding who does what and what a plastic surgeon usually does. So that's why we thought of having a general topic. And Dr. Joyal is my colleague and consultant there at Believers Hospital. So he has consented to make a presentation on the overview of what we as plastic surgeons do and to demystify some of the myths associated with plastic surgery. So may I welcome Dr. Joyal to start the presentation.
Thank you, sir. So, just a briefly about plastic surgery. It's a super specialty dealing with a wide variety of conditions, broadly divided into cosmetic, reconstructive surgery, and hand surgery. So we are a specialty that's different in a way that we deal with all the age groups from neonate to the elderly, and we coordinate with a lot of specialties, and we are not organ restricted, and we are guided by principles which are the known as the principles of the Harold Gillis, the 10 commandments of plastic surgery. We are guided by the principles of plastic surgery, and we are surrounded by a lot of myths and misconceptions by public and even by uh, fellow doctors. So briefly about the history, the Susruta Samhita is the oldest record of plastic surgery. And the Susruta is known as the father of plastic surgery. And plastic surgery flourished World War times, and Sir Harold Gillis is the father. As I said before, he laid the principles of plastic surgery. He's the father of, known as the father of modern plastic surgery. So coming, I'm here. I'm planning to share some 10 myths surrounding the plastic surgery for a very long time. So I feel like I will be discussing the myth and the fact regarding that. So the myth number one is plastic surgery and cosmetic surgery the same? Cosmetic surgery is only a part of plastic surgery, and the other broad subdivisions of plastic surgery are reconstructive surgery and hand surgery. So, to briefly describe the cosmetic surgery procedures, we have to describe from head to toe. The coming to the scalp, it can be medical management of hair loss, injections for hair loss, hair transplantation. And coming to the face, it can be injectables for correcting the uh, wrinkles and contour deformities of the aging features of the face by fat grafting. And also there is eyelid surgeries, rhinoplasties, and autoplasty, and the breast surgeries, reduction, augmentation, and breast liposuction, arm reduction, arm liposuction, abdomen, tummy tucks, liposuction, to name a few. And the reconstructive surgery is again a large field. And we can broadly classify them like this: congenital and infective, neoplastic, traumatic, and iatrogenic. So, reconstructive surgery in a congenital anomalies like cleft lip, cleft palate, ear deformities, and craniofacial deformities, and infective sequelae of diabetic foot, necrotizing fasciitis, and neoplastic skin soft tissue neoplasms, reconstruction of the head and neck tumors, and trauma ranging from burns, degloving injuries, tendon injuries, bone defects, vascular injuries. And we collaborate with a lot of other departments from neurosurgery to oncosurgery for assisting them in cases and also dealing with the complications. So again, hand surgery is another field, is a very broad field with the deformities, congenital deformities of like syndactyly, polydactyly, and infective hand infections, diabetic infections, and hand tumors, ranging from skin lesions to bone tumors, and hand trauma, ranging from skin laceration to tendon loss, tendon injury, bone, finger fractures, vascular injuries of the hand, and brachial plexus injuries. And also, we collaborate with other departments from hand surgery, along with hand surgery. Here we have a hand surgery department, so we collaborate with them in difficult cases. So, myth number 2: plastic surgery leaves no scars. This is a common myth among the public and even the doctors. So, no surgery can be scarless. So, plastic surgeons achieve a better scar by following some principles or techniques. It is like we place the incisions along the folds of the face, of the axilla, etc. We hide the scar behind an anatomic structure. Like in a facelift, the posterior extent of the scar is hidden behind the ear. And also we handle the tissues gently, avoid tight suturing. We use fine sutures, and we promote early suture removal, and we give good post-surgical scar care and sun protection. Uh, all this amounts to a good scar, but it's not scarless. So, for example, in this case, the scar, it's hidden. There is a scar after the nevus excision, but it's hidden behind the ear. And this is another case of a large forehead laceration, which has been sutured well by following all these principles, and the result is pretty acceptable and with a happy patient. So the myth number 3 is might sound funny, but it's very common misconception that plastic surgery does we use plastic materials in the body. Is that the reason for the term plastic? Actually, the word plastic in plastic surgery is derived from a Greek word meaning plastikos. It means to mold or reshape. So, since plastic surgery involves reshaping of the structures to restore the form and function, so hence the term plastic in plastic surgery. So myth number 4 is again a common misconception that liposuction is for weight loss. But is this true? No, it's not a weight loss procedure. It's a body contouring procedure. So in liposuction we use smaller fine cannulas to suction out fat from certain pockets like the abdomen, arms, etc., chest, etc. So it helps removing the subcutaneous stubborn fat. Stubborn fat means the fat that is not responding to exercise or other lifestyle measures. So the commonly treated areas are abdomen and arms, and also chest. Briefly about liposuction, after the procedure, we expect the minimal amount of weight loss will be there, but it's not amounting to the amount of the fat aspirated, because fat is less denser than water. And the post-operative compression garments have to be worn for 2 to 3 months after the liposuction procedure, and the final results will take 3 to 6 months. And also patients should follow the diet regimens and exercise regimens to maintain the result. Otherwise, there's a chance of recurrence of the fat. So ideally, a liposuction in any area should be ideally done in a patient with a BMI less than 35. And more than 35, the patient is coming to us, we directly refer them to gastro or other departments for the weight, if they are coming with intention of weight loss. So these are some examples of liposuction. This is an example of a buffalo hump which has been corrected by the liposuction procedure. The results are after 3 months after the surgery. So another case of arm liposuction in which without so we have been able to achieve a better result to the arms by suctioning out the fat alone. The skin has redirected to an acceptable level after 3 months. So liposuction is also combined with the other surgeries like abdominoplasties, tummy tucks, gynecomastia corrections, arm lift, and also for large lipoma removals. So myth number 5. First aid in burns. Applying toothpaste, is it the right way? Never. Applying toothpaste in burns can cause infection, and it can worsen the injury by the trapping of the heat between skin and the material. So even the commonest mistake after a burns people do is to apply such over the materials like toothpaste, other powders, oils, etc. So this all can cause infection, and this is not the first. This is not the first aid is only cooling the universal. What is the universal first aid? First aid is cooling the burned area with running water for 20 minutes. If it is a small area like hand or feet, we can dip the burned a part in a bucket for 20 minutes. Or if it's in the body burns, we can shower in normal water for 20 minutes. This is the universal first aid and it should be followed. So coming to myth number 6, all burn injuries are only skin deep and there is no need for any surgery. It will all heal by itself by dressings. This is a myth. And usually some of the burns are actually only skin deep, like scalds, which are burns due to hot liquids. So but different. The deeper burns. There are deeper burns. Flame burns can be deep, and also electric burns can cause a lot of damage to deeper structures like muscle, tendon, and even bone. To justify my statement, I am showing you an example. Electric burns. Is this burn in the finger? Is this only skin deep? Let's see. So this is the actual extent of the burn in this electric burn after debridement. We have removed the dead skin, fat, the tendons, even the outer cortex of the bone to achieve good bleeding from the bone edges. So this is the defect. This is the actual depth of the burn that you see. So how was this managed after the debridement? We did a flap. This is a piece of vascularized tissue raised from the our body. In this case, it was the groin flap. And after a serial number of surgeries, we were able to achieve this result in this patient. And patient is happy and functional with a functional hand. So the another myth number 7, any doctor can perform plastic surgery. In this era of social media and Instagram, post, we can even if you see the reels, you can see a lot of persons uh, performing plastic surgery, or they claim to be a plastic surgeon or aesthetic surgeon or aesthetic physician. So these are all basically unqualified professionals trying to attract attention for these procedures. So as a plastic surgeon, our qualification is we have to do the basic MBBS degree followed by the 3 years in general surgery training. It can be MS or a DNB general surgery, or followed by 3 years of plastic surgery training, MCH or DNB. And also some centers are uh, giving 6 years of direct plastic surgery course after the MBBS also. So only these courses are those who are done these courses are can call them as a qualified plastic surgeon. So beware of the aesthetic physicians or aesthetic surgeons around us who are afraid to display their degrees. And there is a steep rise in the complications from unqualified doctors or technicians performing surgeries in private clinics, leading to morbidity and mortality. The recent example being a hair transplant, donor site infection leading to necrotizing fasciitis, and the morbidity to the patient, which was highlighted in the media recently. And the problem with a non-unqualified person doing a surgery is they doesn't know the basics of the sterility. They do not have tissue respect, and they are unable to select the patients before surgery, or they are not able to anticipate complications or even clinically detect a complication or manage it if they arise. So myth number 8 is cosmetic plastic surgery is only for women. So both men and women undergo plastic surgery, cosmetic plastic surgery. And according to the latest International Society of Plastic Surgery Global Survey, these are the top 5 male cosmetic surgeries that has been done. That's number 1 is eyelid surgery. This is according to the latest guidelines, the latest survey. Second is gynecomastia correction. Third is scar revision. 4 is liposuction, followed by rhinoplasty. So gynecomastia correction by chest liposuction and gland removal. This is the commonest male cosmetic surgery done at our hospital, followed by abdominal liposuction and rhinoplasty. So myth number 9, plastic surgery is dangerous. We see a lot of social media posts regarding botched surgeries, botched plastic surgery. But is it really all plastic surgery, are they dangerous? So major plastic surgeries carry the same amount of risk as any elective planned surgery. So we have to set the more stressing on the cosmetic surgery part. We have to be realistic about our expectations, and as a patient, we should make sure that your operating surgeon is well qualified in doing the surgery, and also you should adhere to the post-surgery instructions that are uh, instructed by your surgeon. And as a surgeon, we have to how can we make the surgery more safer is by proper patient selection and pre-surgical preparations, and following adequate safety measures before and after surgery, and good post-surgical care can help reduce the complications and make the procedure a lot safer. So to the final myth is rhinoplasty is it a purely cosmetic surgery? The commonest from our relatives, the commonest comment we get when they know we are a plastic surgeon is, can you make our nose, can you reshape my nose? So it's a common misconception that it's a purely cosmetic surgery. Rhinoplasty is done for various reasons. It can be cosmetic purpose alone in certain things like bulbosity of the tip, or a hump in the nose, or a saddling of the nose, or a white nose. But it can be done for nasal obstruction cases alone. So last month also we had a case in which the rhinoplasty was done only for correcting the nasal obstruction due to severe septal deviation. So severe septal deviations cannot be corrected by septoplasty alone. So we get referral from ENT for correction of the septal deviation, and we have to sometimes remove the entire septum and recreate septum from the rib cartilage of the patient. In some cases, there is a combination of nasal obstruction and cosmetic concerns, like deviated nose with nasal obstruction, etc. So to show a few examples of rhinoplasty, this was a recently done case. It's a bulbous tip. The tip is rounded tip with a saddling of the dorsum. There's a scooped out dorsum. This was purely cosmetic concern, and we could address the concerns by narrowing the tip, and also the dorsum of the nose was augmented by cartilage graft from the rib. And this was another case of, and this was a nasal case with a deviated nose with nasal obstruction. And he had a short nose with a small dorsal hump also. So this is an ideal case in which there is a both functional component and also the cosmetic aspect. So we did the dorsal hump correction, and we made the nose longer, and also we made the nose straighter, and his nasal obstruction was also improved by all these measures. So this is to sum up the some common 10 myths in plastic surgery. So as Dr. Deepak sir had told, July 15th is celebrated as a World Plastic Surgery Day. We had conducted a quiz program for the undergraduates, and also some awareness talks in nursing department, and also in general surgery and among the general surgery colleagues. So this is our team with transforming. We are able to transform lives with compassionate care. Thank you. Thank you for giving me an opportunity to share our regarding this, giving time for this talk. Thank you.
Thank you, Joel, for the very lucid and simple presentation. Joel has just given an overview about some of the most common misconceptions or myths regarding our specialty. There are many more, but he has tried to condense it and uh, suggest or present some of the very common things, like that plastic surgery is only mainly cosmetic only, etc. So if anyone has any questions, they can just ask. Dr. Joel is available, or myself.
Thanks, Devu and Joel. Some myths like toothpaste or actually കൊച്ചുകുട്ടികളായിരിക്കുമ്പോൾ ഞങ്ങളൊക്കെ ചെയ്ത് ഞാൻ 2-3 പേരെ വിളിച്ച് ഗ്രൂപ്പിൽ ആരും ഇല്ലാത്തതുകൊണ്ട് ജോൺ തച്ചൽ യു മൈറ്റ് ബി നോയിങ് ഹി ഈസ് മൈ ക്ലാസ്മേറ്റ് തച്ചില ക്യാൻ യു സ്പീക്ക് ഹി ഈസ് ഓൾസോ പ്ലാസ്റ്റിക് സർജൻ തച്ചിൽ ഇപ്പൊ അമേരിക്കയിലാന്ന് തോന്നുന്നു ജോൺ തച്ചിൽ ഫ്രം മൈ ബാച്ച് ഓഫ് 1976 സരിത ഷെനോയ് then ഷീല ജോസഫ് ഫ്രം 76 ബാച്ച് പിന്നെ ജിയ ഇത്രയും പേര് വന്നിട്ടുണ്ട്. അപ്പൊ ടച്ചിലാണ് അപ്പൊ ഞങ്ങളുടെ ബാച്ച്. ഇപ്പൊ ഞാൻ 1976 ബാച്ചിൽ ഇട്ടുകൊടുത്തു. അപ്പൊ ടച്ചിൽ വന്നിട്ട് ജോൺ ടച്ചിലാണ്. സോ ക്യാൻ ഹി സം അപ്പ്? ഹി ഈസ് ഓൾസോ പ്ലാസ്റ്റിക് സർജൻ.
Regarding burns, it is not. It is still very rampant. Everybody is still like out of maybe 6 or 7 patients out of the 10 who present to our clinic or the ER with following a burns, they come after applying toothpaste. So still that stigma has not gone. Still, that is until our parents' era, they still believe that, most of them believe that applying toothpaste, honey, butter, ghee, milk, etc., all sort of things people keep on applying. When the ideal first aid is easily available everywhere and very simple to use. But what we have to stress is immediate cooling is the key. Immediate cooling under running tap water. Or when tap water is not available, you can even immerse in a big container containing water.
John
Anything else
Thatchell,
regarding?
will you speak?
Sir. Madam, he's actually, we are not aware. Where is this Dr. John Thatchell?
നവീൻ അല്ല ഇതിനകത്ത് കേറിയിട്ടുണ്ട്, അതുകൊണ്ടാണ് ഞാൻ പറഞ്ഞത്.
ഉണ്ടോ? ഓക്കെ
ആ,
ഓക്കെ.
11 പേരുണ്ട്. സച്ചിനുണ്ട്, സരിതയുണ്ട്, റംലയുണ്ട്.
Sarita madam, I know. അതെ അതെ, Sarita madam, I know.
അജയ്
Yeah, this is John Thatchell. Thank you for sharing the info on plastic.
Yes.
The reason I was listening to the topic is my daughter is a second-year plastic surgery resident here, and I thought I will challenge her with some of the questions.
Okay.
I'm an oncologist myself, not into plastic.
Okay, sir. Okay.
So yeah, I enjoyed the topic. My daughter talks to me about her plastic experiences on a regular basis, so I thought I will just stay myself up to date as to what's going on in the plastic field.
Okay.
Enjoyed the talk. Thank you for sharing.
Yes, yes. Dr. Sarita madam's husband is also a plastic surgeon.
ഞാനിപ്പോ അയച്ചു കൊടുത്തു, എന്നിട്ട് നിർബന്ധിച്ച എല്ലാരെയും കേറാൻ.
Sarita madam has joined.
Thank you, Dr. Deepak and Dr. Joyal. And thank you, Annama madam, for sharing the link. വളരെ simple ഒരു talk ആയിരുന്നു. It would have been useful to anybody, general knowledge regarding plastic surgery. Kore myths, good way of presenting it. Myths busters ആയിട്ട് present ചെയ്തത് was very nice way of presentation. Very cute presentation. Thank you. I'll convey to Ajay. He has not reached home. And
Anybody else wants to make any comment or any questions?
Ramla.
Madam, liposuction was another thing which is. Ramla, madam. No, liposuction was also in the headlines for wrong reasons over the last couple of months, following a complication. It was in the print media and all. People are very much scared about some. At least some of them are scared about liposuction after hearing some unfortunate events. But the way the media presents it in the print is also not actually fully justified. So we need to for a detailed discussion, we need to have a separate talk regarding liposuction. There are a lot of things which a person has to be aware before going for a liposuction. Like Joyal said, first and foremost, you have to know whether it is being performed by a fully qualified surgeon. Second, you have to do it at a center with adequate facilities, not only to do liposuction, but in the event of an unfortunate complication also, you should have the adequate personnel to manage it. Most of the clinics in our cities, they don't have any full-time consultants and other specialists, and also they don't have any critical care facilities, even though a rare complication occurs. So the patients should actually search for a qualified doctor. That is the most important aspect. Joel, you want to add anything?
Dia and Ramla didn't talk.
Jijo?
Thank you, Deepak, for the lucid talk and introducing all of us towards plastic surgery. Like rightly said, it was a very beautifully presented with apt examples as to what our experience has been. I'm sure many would have benefited who had listened, and we'll be sharing the recorded link toward in all the other group for the people who have missed it also. With this, we'll plan to wind up the session for today, and we will be meeting all next Wednesday with our next session. Thank you, Deepak, for the coming up in such a short notice.
Okay, Joel. Thank you, Joel.
Thank you, Joel, also for the excellent talk.
Thank you.
Thank you.
Okay. Shall we stop the Zoom meeting?
Yes.
Yes.